Okay, we're going to start here with what are the three types of muscle tissue? We've been reviewing this a bunch. Do you remember? You should, hopefully. It's skeletal, cardiac, and smooth. Remember, skeletal attaches to bones, it's striated, they have many nuclei, voluntary, and remember that generates a lot of our body heat. Cardiac muscle tissue only in the heart, it's striated, it's involuntary, and it has intercalated discs. And then we have smooth muscle, which found in the walls of many organs, no striations, involuntary. Also, remember, smooth muscle is the type of muscle tissue that heals well. Skeletal muscles are attached to bones with tendons. So that's strong, durable, connective tissue. All right, before we go any further, let's check out a fun fact. I love to do this one. Okay, so here's what you're going to do. You're going to take your hand and hold it in supination. Remember, like asking for supination, not pronation, supination. And then you're going to touch your pinky finger to your thumb in opposition. Remember, this movement is opposition, okay? And then you are going to flex your wrist a little bit. Okay, so here you can see my wrist is straight, and then you want to flex your wrist a little bit, and then you're going to be looking right here, okay? So you're going to look right here. You can see in my hand, I do not see any visible tendon when I do that. So I have my pinky touching my thumb, and then I flex my wrist. I can't see any tendon. Same thing happens when I show this side, right? We're watching right here, and I do not see, if I say wrinkles, no tendon. So what you're going to do is, do you see that tendon? You can see in this illustration here, this is like what mine showed, wrinkles, but no tendon coming up right here. That's what you would see if you see the tendon. Here you can see it present, here it's present. So what is this tendon? It is the tendon from a muscle called the palmaris longus muscle. So think about what that means. Palmaris, palm, longus, it's a long muscle. So the palmaris longus muscle, okay, you can see is attaching up here to my humerus and going all the way down across my radius and ulna, and it attaches to the metacarpals in my palmar area. So 10 to 16% of the population are born without the muscle. That's me, okay? Now you could have it in both, you could have it in neither, or you could have it in one. Some people, again, have it in one wrist, but not the other. Well, what if you're like me and you don't have it? It's missing. Well, no need to worry. The presence or absence of this muscle has literally no effect on grip strength. It's kind of like a spare tire. So the tendon from this muscle, which you can see being removed here, is sometimes used as a source of grafting material in surgery if someone had to repair another tendon. So if somebody had a different tendon that they needed repaired, they could use the tendon from the palmaris longus muscle. You have a similar muscle that can be used as a graft source in the popliteal region behind your knee, in the posterior knee region. But that one's a little bit hard to see. This one, when you just, is easy to see. Now you have to learn a list of muscles. Today we're going to talk about these muscles. Now we already introduced this Duchenne muscular dystrophy, right? This is a genetic disorder with progressive muscle weakness and degeneration. Well, what muscles are affected first? So if it's a progressive weakness and progressive degeneration, which muscles are affected first? Well, the lower external muscles are affected first. That means children suffering from Duchenne muscular dystrophy will lose control of their before they lose control of their arms, meaning they will be in a wheelchair sooner, typically, than they lose functionality of their arm. Also external, so the muscles closer to the surface of the skin. So again, internal versus external. So we have a lot of muscles that are buried in layers upon layers under muscles. So the muscles that are going to be affected first are more external, and then they will move internal. In addition, it is going to be the lower appendicular skeleton first. And then again, which muscles are affected first? Well, proximal muscles, okay? Remember the difference between proximal and distal? So I'm looking at one arm or one leg. Proximal means closer to the point of attachment. So for an arm, that's shoulder. For a leg, that's hip, okay? And distal is further away. So my distal phalange is distal to my intermediate phalange. My metacarpals are distal to the carpals, but my metacarpals are proximal to any of the phalanges, okay? Because again, our body has to be assumed to be in anatomical position. Distal is further away, think distant, right? Proximal, proximity. And again, we can only be talking about one arm or one leg. So you can't use it to talk about anything on the cranium or the face or the torso. Not possible. We can only compare one arm to one leg. So I can't compare a hand and a foot. I can't compare a thigh and the brachial region. Absolutely not. One arm and one leg. Okay, so again, the ones that are closer are going to be affected first, the ones that are where the limbs attach to the skeleton. So it follows all these kind of general patterns of weakness and degeneration. So lower first, proximal first, external first. All right, so now it's time to go over some of the muscles. So think about the muscles that might be affected first in Duchenne muscular dystrophy, or DMD. You should have this handout, okay? There is one error. Do you see right there, number 17, that number 17? There is a correct number 17 right here. This number 17 was left in error, but I wasn't going to print 100 pieces of paper again. No, I can't. I just can't do it. So you need to remove the 17 that was right here. Just cross it out. That's it. Okay. This 17 is correct. The 17 that was here, get rid of it. Okay. All right. So now let's talk about it. You have your prex. That's your pectoralis major in your mammary region. Sternocleidomastoid. One of my favorite muscle names. Okay, it's named based on all of its attachment. So sterno, it's attached to the sternum. Cleido, attached to the clavicle. Mastoid, it's attached to the mastoid process in your cranium. Then we have sartorius, like a whip. Sartorius. It is like a belt strap. It is the longest muscle. You can see that it goes all the way from your ilium all the way down to your tibia, wraps all the way around. It allows you to go crisscross applesauce. Your trapezius is shaped like a trapezoid. Now, for most people, this muscle is much less evident when you're looking from an anterior view. But in bodybuilders, we see the trapezius clearer from the anterior. Then we have wrist flexors. So an example of this is the palmaris longus, which we already looked at. So when we flex our wrist, do this, okay? And then we have wrist extensors. So they're located here on the other side. So that's going to allow me to extend or hyperextend my wrist. An example of that is, not shockingly, extensor. It extends. Carpi, carpal area, and ulnaris. It runs along the ulnar side. Okay, so you can see the extensor, carpi, ulnaris. Now we have some gluteal muscles. We have gluteus maximus, that's the biggest one. We have gluteus medius, That's the medium-sized one. It's found, you can see, superior to it. And then deep to these muscles is truly gluteus minimus, but I don't ask that one because we can't see it from a superficial view. We have gastrocnemius. So I remember it because that C stuck in the middle stands for calf. Okay. And then soleus is closer to the sole. It's also hidden behind the gastrocnemius. So the gastrocnemius is more superficial and the soleus is deeper. Then we have the quadriceps. Okay, the quadriceps is a group of, not shockingly, 4 muscles, not the sartorius, okay, but other muscles. We're not going to learn the individual names of the quadricep muscles, but you should know that it's 4 and that it's in the femoral region on the anterior side. On the other side, femoral region on the posterior, we have hamstrings. These are 3 muscles. Again, I am not testing you on the names of the individual hamstring muscles, just the hamstrings. All right, so let's go through a lot of these muscles. We have deltoid, we have trapezius, we have sternocleidomastoid, we have biceps brachii. Biceps brachii, right, in the brachial region. We have the pectoralis major. We have sternal oblique. We have rectus abdominis. And we have wrist flexors, right? The palmaris longus as an example. Then on the back, we have erector spinae. Now, some of this is going to be more deep to some of the muscles that we can see, but that's the part of the muscle that is clearly evident. We have trapezius, we have deltoid, we have the latissimus dorsi. Some people call them lats. We have triceps brachii, and here we have wrist extensors, right? The wrist extensors, like the extensor carpi ulnaris. And then we have what? External oblique we did. We have rectus abdominis. We have the wrist flexors like palmaris longus. Then we have that sartorius, that we have the quadriceps. And then we have adductors, allowing you to do this with your legs, bring them back together. All right, we have here the wrist extensors, like extensor carpi ulnaris. We have the latissimus dorsi. We have the gluteus maximus. We have the gluteus medius. We have the hamstrings. We have the gastrocnemius. And we have the erector spinae. We also have the adductors, so that can be seen from either side. And then moving lower, we have sartorius, quadriceps, adductors, tibialis anterior, and then lower from the posterior view, we have hamstrings, gastrocnemius. That is your Achilles tendon, and deeper to that gastrocnemius is the soleus. We have the adductors, and we have gluteus maximus. All right, now let's focus on the muscles of the face and neck that are included. So this is a bit zoomed in, but let's go through these muscles. So what you can see here is that sternocleidomastoid muscle. This one over here is the trapezius. Right there is frontalis. Right there is orbicularis oculi. Right there is orbicularis oris. Right there is zygomaticus. Makes sense because it attaches to that zygomatic bone. Here we have masseter. Now there are other facial muscles, okay, but a little hard to see in this limited diagram, so we're going to look at them later, okay? So what muscles would be affected first in DMD? Do you remember? So looking at that, and here's the list of names, right? What muscles would be affected first? If you said muscles in this region, either anterior or posterior, you'd be right, right? Because it needs to be lower and also proximal. But then we would also have muscles in this area, right? That are also proximal, okay? Then it would move to deeper muscles and more distal muscles. And remember, lower limbs first before upper limbs. Ooh, we sure learned a lot about muscle names, didn't we?